Barbara. As the world battles with the COVID-19 pandemic, various countries have begun with immunization after a long-awaited vaccine. In the midst of the pandemic and vaccine trials, traditional health practitioners offered their advice and traditional remedies to assist government in combating the spread of the virus. A common challenge for traditional health practitioners in South Africa has been the inability to expand their market reach due to lack of resources and skills to develop traditional medicine products that conform to acceptable standards of safety and quality. The Council for Scientific and Industrial Research has stepped in and assisted a number of traditional health practitioners in developing safe and standardized traditional medicines for commercialization in a project funded by the Department of Science and Innovation. To hear more about this initiative, we're now joined via Zoom by Dr. Blessed Okole. He is research group leader of the Agro-processing at CSIR. A very good afternoon to you, Doctor. Thank you so very much for being with us here on SABC News, sir.
Good afternoon, Flo. Good afternoon, listeners.
Let's talk about the sort of assistance that you've given or that you're offering traditional health practitioners in the work that they do. And on the back of that, is there starting to be more of a demand for traditional healers as time goes while we're dealing with this pandemic?
Yeah, we have in that situation. In fact, when we had this call, we had almost 35 traditional healers who wanted to participate in this program. Yeah. And it was really interesting because we had to go through an expression of interest process, and we selected 6 of them that we went through the process to have 6 products. Each of them had at least 1 product, which we took to the level for which they can commercialize their product.
Yeah, and then I just also want to ask about, where the WHO stands on this. I mean, in the beginning, when we were dealing with COVID-19, there was a lot of sort of, a call for caution from the WHO when it comes to any sort of medicines that they haven't put their stamp on. And I'm wondering now, as you step in and as you're being backed to help traditional health practitioners, does that then mean that there's also some sort of an agreement or that the WHO is supporting this too? I mean, where are we standing in terms of this?
Well, that's the good news. The WHO has put guidelines now for traditional medicine. Yeah. So South Africa, fortunately, South Africans also, we have Professor SABC, who is part of the board of the WHO panel, and they have guidelines now on what we have to do to take our products to that level that will meet standards. Yeah.
Yeah. And then talk to us about, what your stance has been, when you decided that, as an organization, you would take your time and your resources and also reaching out to government in terms of finding solutions when it comes to traditional health practitioners. I mean, I'm sure you know that over time they have complained about the fact that they haven't been included. So I'd like to know where this inclusion actually started and that whole entire process.
Yeah, we have almost 200,000 traditional health practitioners in South Africa. That's a huge number, yeah. Which means in every community you have, those are the primary health care that you get. You first go to the traditional health practitioner. If it doesn't work, before you go to Western medicines. But most of the time you have positive results when you go and see them. So we've been looking at what they've been doing, and we said, no, let's try and we are a science council, let's try and see how we can use science, technology, and innovation to improve their products, to make it safe, to make it efficacious, and to improve the quality. So the Department of Science and Innovation had to put up a consortium together. So it's not only the CSIR that is involved, there's a large consortium also giving them business skills. The Innovation Hub at Coach Lab is giving them business skills. The South African Bureau of Standards is looking at the quality and the packaging and labeling. So it's a consortium that the Department of Science and Technology put together for us to work on with the traditional healers. Our role is mainly on the product and process development.
I would imagine that there are a huge number of people who still sort of have blinkers when it comes to issues relating to medicines and really want, what is westernized or Western sort of medicine. Would you say that, given the chance and the adequate resources and the help that you're kind of giving to traditional healers, that traditional medicine can indeed have a chance to be put on a sort of bigger market and start to, people that were generally more into the Western sort of medicines might actually want to start trying out traditional medicines?
Flo, we have a product that was developed for the Gwatsane village in Limpopo, Mr. Colin. It's a cooperative, and this is a petroleum jelly. Okay, if you look at it, it's from an alloy. It used to treat sores, stomach, and skin problems. If you look at this product now and compare a product from Avon or from one of the top manufacturing houses, it's the same. It's the same. So that's why we brought SABC also on board. We want to produce products that will meet international standards. It's not only for South Africa. So the products that we've worked with them now can sell in the international market. And we did most of the tests. For example, the skin product, which I said, we did dermal safety tests to meet the standards, also international standards, for a product that you're going to put on your body.
Let's talk about going forward. Will we see the CSIR making more effort or collaborative efforts where traditional practitioners and medicines are concerned? Have you found that it was indeed fruitful to do so?
Well, it was a very good project and a learning curve for us also, us and for the traditional healers, because we worked, both of us, all through the way. It's not like you dictate to the traditional healer. It was kind of collaborative. They are telling us which herb you have to put first, which herb you have to put second. A learning curve for us also. So we've learned a lot from this. We're working with the Department of Science and Innovation. We're also working, interestingly, with the international relations and with the Department of Agriculture, and also with DTI, to see how we can expand, to make it more inclusive, to have more people participate in the program.
Doctor, do you think that COVID-19 has shone some sort of a light on traditional health practitioners and medicines? I mean, it's now that you're hearing a lot of people who you would think would really want more westernized medicines that are starting to talk quite a bit about traditional medicines. And I wonder if it's mainly because of the COVID-19 shining that light on traditional medicine, or were we sort of going that direction in any case? I mean, what's been your analysis, particularly in the past year? I mean, there are some people who swear by, I'd hate to say the name incorrectly, but there's some herb that people swear by that, if you steam with it, it will help you in terms of COVID-19. I mean, I'm just wondering if you're looking at the track record, if perhaps COVID-19 was what was needed to shine a light on traditional medicine. I mean, what do you think?
No, you're right. Many people now are looking towards traditional medicine because the Western medicine is not common in every hospital. You go to hospitals, they have many foods, so you have to treat yourself. So they go to the traditional practitioner. The government, through the Department of Science and Innovation, has also formed a consortium with traditional health practitioners to see how we can come with cure or with immune boosters that can also help in curing or preventing SARS-CoV-2, and we already have leads that we are working with. We already have leads that we have started working with, and this consortium hopefully will definitely bring some products using the WHO guidelines into the market.
All right. Thank you so very much for speaking to us, Doctor. We appreciate your time here on SABC News.
Thank you very much.
All right, that's Dr. Blessed Okole. He's the research group leader of Agro-processing at the CSIR. Well.